Hello everyone, welcome to my YouTube channel Banuprathiba Lectures. Today we will be talking about the osteology of clavicle. Clavicle is also known as the collarbone and it is the only bony attachment between your trunk and the upper limb, and hence it is also a connection between your root of the neck and also the trunk. So here let us see the parts of the clavicle. So the clavicle has three parts, one lateral end, one medial end and the shaft in between. So clavicle is a very simple one but also a tricky one in our vivas because of its peculiar features. So let us look into the peculiarities of clavicle now. So the first and foremost thing is clavicle is an S-shaped long bone and it is the only long bone to be placed horizontally, because most of the other long bones like your humerus, radius and ulna of your upper limb are also long bones but they are placed vertically. Now, it is also subcutaneous throughout. So you can palpate the clavicle from the lateral end to the medial end throughout its extent, and it has no medullary cavity. Even though it is a very controversial topic that some authors and anatomists say that there is medullary cavity, let us stick to the usual point that there is no medullary cavity. Now, another important thing that we need to keep in mind with respect to ossification is it is the first bone to start ossification. That is, in the 4th or the 5th week of intrauterine life itself, it starts to ossify. And contrarily, it is the last bone to complete ossification, that is 25 years. Now, with respect to the ossification, the centers of ossification, we have to note that it has two primary centers of ossification, while most of the long bones have only one primary center and a secondary center of ossification. So if you look into this image, there are two primary centers in the shaft, one with respect to the medial end and one with the lateral end. So, and then there is a secondary center in the sternal end, and sometimes occasionally there might be a secondary center in the lateral end as well. Now, it is the only long bone to undergo membranous ossification. So, most of the long bones undergo cartilaginous ossification, but clavicle is the only bone that can undergo both and predominantly membranous ossification from the lateral half, while only the medial end will undergo cartilaginous ossification. So altogether the clavicle undergoes membranocartilaginous ossification. And the last point that we need to keep in mind is occasionally the clavicle might be pierced by a nerve called the intermediate supraclavicular nerve, which is a cutaneous nerve. So what do you mean by cutaneous? Cutaneous means which is going to supply the superficial part of your skin. Now, with that being said, let us dive deeper into the anatomical position and side determination of the clavicle. So this is the image of a clavicle and how it joins with the other bones as well. So here, as I said earlier, there are two ends, a medial end and a lateral end and the shaft. So if you see here, this is the medial end. The medial end is going to be large and quadrangular in shape, and it is going to be attached to the sternum and the first rib, and it forms the sternoclavicular joint with the manubrium of sterni. And whereas the lateral part is flattened, the lateral end is flattened above and below, and it is going to be connected with the acromion process of the scapula, and it is going to form the acromioclavicular joint. So any joint here we can easily remember by how it is going to connect with two bones. So for here it is going to start from the sternum and attach with the clavicle, so it is called sternoclavicular joint, and here it is connecting with the acromion process of the scapula and with the clavicle, so we are calling it acromioclavicular joint. Now, how do you determine the side and the anatomical position of the clavicle? The medial end and the lateral end are there, but in between you have the shaft. So this shaft is going to be divided into two ends. Okay, so we are going to divide the shaft total shaft into two types. So one is the medial 2/3 and the lateral 1/3. So I will call this part the medial 2/3 and this part as lateral 1/3. So how will you identify? The medial 2/3 will be convex forwards, whereas the lateral 1/3 will be concave forwards. So this is one of the key identification points for clavicle. And then the superior surface. So this is the superior view of the clavicle. It is going to be, the superior surface is going to be smooth, whereas in the inferior surface you can see a subclavian groove present here. So subclavian groove. So sub means below. If we are going to divide this, sub means below, and clavicle. So below the clavicle you have a groove, and there is also a specialized muscle is present here that is called subclavius muscle that is going to provide, support for this bone. Okay. Now let us dive deeper into the features of your lateral end, medial end and the shaft. So in the lateral end, in the superior surface, you have an oval facet that is going to be attached with the acromion process of the scapula, and in the medial end you have a small articular facet for it to attach with the sternum. And then in the posterior side, in the below, as I already told, there is a subclavian groove, but apart from that there are three important structures as well. So compared to the superior surface, the inferior surface is going to be very rough and it is going to have a lot of impressions. So first impression or the first elevation is called the conoid tubercle, and then it continues to form a trapezoid ridge. So these two are going to give attachment to a ligament called coracoclavicular ligament. Is it called? Coracoclavicular ligament that is going to connect your clavicle with the scapula, which is the adjacent bone. And then in the medial end, in the inferior surface, you have an oval facet or an oval shadow that is called the costal tuberosity or costal facet that is going to give attachment to a ligament called costoclavicular ligament. So these two ligaments together, the costoclavicular and the coracoclavicular ligament are going to form one ligament that is called coracocostal ligament that will connect itself with the first rib. Now, we will talk about the boundaries, the surface and the borders of your angles, for your ends. So in the lateral end, we have one superior surface and one inferior surface, and then two borders, one anterior border, let me highlight this, one anterior border and one posterior border. So we have one superior surface, one inferior surface, one anterior border and one posterior border. And then in the medial surface, we have all four surfaces. There is no borders or there is no marked elevation or a sharp border that is going to divide the four surfaces of your medial end. It is quadrangular and it is almost rounded. So we have just four surfaces. So this should be the superior surface, this will be the inferior surface, and then this should be the anterior surface, and this will be the posterior surface. Okay, so we will now move on to the muscle attachments of these bones. Now, this is the superior view. We will go through each end. So in the lateral end, in the posterior side, we have the insertion of the trapezius muscle, and in the anterior border, we have the insertion of your deltoid, origin of your deltoid muscle. And then here, coming to the lateral most end, where you had the oval facet, there we have the acromioclavicular ligament that is going to connect it with the scapula. Whereas in the medial end, you have almost most of your important muscle. In the superior surface, you have your sternocleidomastoid muscle, which is going to connect your sternoclavicle to to your mastoid process, which is in behind your ear, the process which you can palpate, that is called sternocleidomastoid. And then in the inferior surface, I'm just marking out the important muscles that you need to know. That would be easier to understand the gross anatomy part as well as to answer in the osteology viva as well. So here we will be able to see the costocavicular ligament, which we saw already, the sternohyoid muscle. So if you see under your neck, under your chin, if you press, palpate harder, you can able to touch a bone. So that bone is called the hyoid bone. So from the sternum to the hyoid, there are some muscles called strap muscles, which you will be learning further in the head and neck classes. But this muscle is called sternohyoid muscle. And under the subclavian groove, you have the subclavius muscle and then the trapezoid muscle attaching itself to the trapezoid ridge. Now, let us see what are the common clinical aspects of your clavicle. So, clavicle, being said that its ossification ends only at the 25th year, it is a very common bone to be fractured. So, the most common site of fracture is between the medial 2/3 and the lateral 1/3. So, for example, look at this X-ray where you can see this is the medial end and this is the lateral end. So the clavicle is fractured here, and at which point the junction between the medial 2/3 and the lateral 2/3. So what happens? Why does the medial end is rising above whereas the lateral end is below? That is because of the muscle attachments produced here. So in the medial end, you have a superior muscle that is called sternocleidomastoid. So it has a very large, extensive origin and insertion, and it is powerful. Hence, it is lifting the medial fragment of the broken clavicle. Whereas in the lateral side, if you reiterate, if you come back to the muscles attached here, it is trapezius and deltoid. So deltoid takes origin there, so it cannot help in supporting the bone. Whereas trapezius is an extensive muscle in the back of your upper limb or in the neck, and hence it is going to support only the bone fragment, and hence it is going down, whereas the sternocleidomastoid overpowers and it pulls the medial fragment upwards and the lateral fragment is pulled downwards. Apart from this, there are some congenital anomalies as well. So that can be clavicular dystosis, that means the non-union or the non-fusion of the lateral and the medial ends of the clavicle. So it doesn't need to be fractured, it is not fused at all. And then another condition is called the cleidocranial dysostosis. So that means there is some ossification malfunction or inappropriate fusion in the skull bone that will affect the ossification of your clavicle as well. I hope I have made this clear and concise. If you have any doubts, you can put it in the comment box. I'll be happy to help you. Thank you. Please don't forget to subscribe and hit the bell icon, and follow us on Instagram also.